Hey guys, welcome back to The Purpose Nurse if you've been on my channel before, but if today is your very first time watching any of my videos or being on my channel, then welcome. So I am excited for today's video. I am now in fall 2019. I literally have 2 more quarters before I graduate from nursing school. I know it's crazy, but I am almost there, y'all. So keep pushing and keep praying for me. But anyways, today's video I'm going to be talking about the 2 rotations that I'm currently in. I am currently in pediatrics and I'm currently in gerontology. So I'm working with kiddos and then I'm working with the elderly, 2 completely different spectrums. So if you are interested in hearing about how my peds and my Gero rotation is going thus far, then keep on watching. But before you go ahead and keep on watching, if you are not subscribed to my channel, stop what you're doing, please, right now. Pause this video, just go ahead and subscribe. And then after that, once you finish the video, let me know if you are liking my content. Let me know if there's anything that I'm not talking about that you would like for me to talk about, and I'll see what I can do for y'all. So let's get into this video. Alright, you guys, so thus far I have completed 2 weeks of peds and 2 weeks of Gero. So let's start with peds. So my very first day of peds nursing, I was nervous. Like, I honestly didn't really know what to expect. I know that I am an emotional individual, so I was like, okay, what if I go to this unit and it's just too much for me and then I just can't control myself or control my emotions? So I immediately was trying to like gather my emotions and prepare myself. But my first week of peds nursing was pretty awesome. I took care of a 2-year-old infant, 2-year-old toddler. She was awesome. She was feisty, but she was still loving. She was so cute. So she was admitted to the hospital because she has a central line. So a central line is something that is usually placed on individuals so that they can draw blood from them, give medications or anything like that. It's just a more stable way, so you're not having to, especially for an infant, to poke them multiple times. But the drawback to this central line that was on her right upper chest area is that it is very susceptible to infection. I mean, think about it. Anytime you have an open hole or anything or skin on your body, like, it's going to be susceptible to infection. So unfortunately she was admitted for bacteremia, which is basically like bacteria that's in the bloodstream. So yeah, that was very interesting, taking care of her, interacting with her. We went to the playroom, and so I played with her for about 2 hours, and that was pretty awesome because I was able to not only observe her while she played, but I was able to, you know, have the toys and play with her. And I was also able to build trust and build a rapport with this infant. So that was really awesome. And I also learned how to communicate with parents because, of course, being on a pediatrics floor, that's besides the patient, which is your infant, toddler, adolescent, you also have the other spectrum, which is the parents that you really have to tend to and focus on as well. Also in peds, for my school specifically, we are not able to pass any type of medications without our clinical instructor, and that is because peds require weight-based calculations, and that's very specific, and you always want to make sure that you're being safe. You want to be safe during medication administration period, but specifically when you're dealing with pediatrics, you want to be very careful. So I did do a med pass with my clinical instructor. She walked me through / watched me do everything, and I did everything correctly, so that was awesome. So moving on to peds day 2, which was yesterday. That was a different kind of day. So I was on a rehab floor versus the floor where I took care of the toddler. That was kind of like a medical surgical peds floor. So on this rehab floor, they literally have schedules for these patients. So the individual that I took care of was a 14-year-old male, and he was brought in because he had some coordination, neurocognitive issues. He, I believe, has or had a history of autoimmune encephalitis, which is basically just inflammation, like all like around the brain. And as you can imagine, that can affect those things I just mentioned, which is like your cognitive, thinking correctly, your coordination, your balance, your gait, which is another term for walking. So I introduced myself to him, and I explained to him that I will be caring for him for the full 12 hours. So literally from about 8:30 all the way to, I say, about 3, we were doing things. So he started off with school, and at school there is a teacher there, and they have little games that they're playing. And so they were teaching my patient along with other patients that were on the unit that were going to school as well. Then after that, there's therapy. So my patient was doing speech therapy, occupational therapy, and physical therapy. And he also met with speech pathology, if I'm correct. I might be wrong about that, but I'm pretty sure it was speech pathology. But it was so cool to watch him do his therapy and be a part of his therapy. A lot of his therapy involved games. So I played Uno, I played Connect 4. He beat me in Connect 4 like 3 times. I beat him in Uno twice. We also took a trip to the grocery store, which was really cool. So my patient has issues with impulsiveness, which is common when you have any type of brain damage to like the frontal area, I believe, of frontal lobe of the brain. So to work on that, we were able to leave the hospitals, myself, 2 of the therapists, and my patient, and we walked to the grocery store. And we walked to the grocery store because we wanted to buy brownies. And so we did things such as going into the grocery store, allowing the patient to figure out which aisle the brownies would be on, and then going to the brownie aisle. But even before doing that, making sure he knows what he needs to make brownies. Like, we need eggs, we need vegetable oil, and we need the brownie mix. So we allowed him to go into the grocery store and look at the different aisles and determine, without any assistance, determine which aisles he needed to go on to get those ingredients to make the brownies. And we were successful, so that was amazing. And we left out of the grocery store, and then we also, to work on his impulsiveness, we wanted to make sure he's aware of his surroundings and knowing, okay, like, don't cross right here at the crosswalk, you know, if this car has not made eye contact with you and you're not able to cross. And so it was just really interesting working with him for me, because he is an adolescent, being 14 years old. So working with adolescents, you really have to respect them wanting to be independent, but also making sure they're safe in whatever they're doing, and making sure you get their assent versus consent. And assent is basically where the adolescent is basically saying, like, okay, like, I'm okay with this. I agree. I'm allowing you to do this, basically, or engage in this activity. I accept, basically, is what that individual will be saying. But it was really, really interesting. And so we made brownies, and the brownies were awesome. And I was able to get ice cream for him, his mom, and his dad, and able to watch the psych team come in and ask him questions, and other healthcare professionals come in and just overlook at their processes, because nursing is not, we don't do nursing by ourselves. You do have to work with other healthcare professionals from other disciplines. So I was able to see that. So yeah, that was my day 2 or week 2 for Peds, because we only go to clinical once a week per specialty. So moving on to Gero. So day 1 of Gero was awesome. We are currently in a skilled nursing facility. And for those of you who don't know, skilled nursing facilities are pretty much places where the elderly go when their functioning and daily living has significantly declined. And some people say that the elderly go there to pass on, but I think that depending upon their condition, you know, and the location of the skilled nursing facility, they do have different types that are long-term skilled nursing but are also short-term outpatient. Fortunately enough, the location that I am at is a combination of the two, so long-term and short-term. So my first day, I was able to work with this amazing resident. And that's another thing that they taught us too with working in the skilled nursing facilities, that you don't call the individuals that are there patients, because they're not patients, they're residents, because they reside in the skilled nursing facility. So I'm trying to catch myself and do better on that. But being in a skilled nursing facility, for my first week, we were assigned a room, and in one room there are 2 patients. So out of those 2 patients, you choose one of the patients and you basically, see, I did it again, I'm just catching myself. residents. You choose one of the residents and you care for them and assist them in eating. You take them to activities, you talk to them, you build communication with them, you help them to the bathroom. The skilled nursing facility to me is not that bad because I was a CNA before, and as a CNA you're doing all of these things that we're technically doing when we go to the skilled nursing facility. So it was kind of, why did I say sore? So it was kind of like nostalgia for me, to be honest. And I think it was very different for some of my classmates who have never been CNAs or are not familiar with skilled nursing facilities. They probably were just kind of like, wait, this is not hospital environment. This is not med surg or anything like that. So it's definitely different. But the resident that I cared for, she was awesome. She was 93 years old. She's originally from Japan. And when I tell y'all that she is sharp, this lady is sharp. Like, having full-blown conversations with her. She is not demented, or, you know, she has the normal degenerative changes that you would expect to see as you get older. But mentally, she's all there, like all there. She will make jokes with me. She was able to feed herself, and she was just really in touch with herself, like who she was. So that was really cool. What else did we do first day? So we go on Wednesdays. So on Wednesdays, they do have set things that they do. They have their breakfast, their lunch, and their dinner. We're only there till 12, so we're not there for dinner, but we do take them to breakfast and lunch. They also have activities where we take them to the activity room, and they're either watching TV or they're doing like exercises in their chair. Also on Wednesdays, they have Bible study, which was really, really, really cool. The denomination is Christian, so there's a Christian pastor that comes and he does Bible studies and he sings worship songs with the patients. And y'all know me, the first day I experienced this, I was like, this is so cool. I'm not sure what my classmates were thinking, because I'm not sure of their, you know, religious beliefs or their background or denomination or whatever the case may be. But your girl was loving it. Like, I really was loving it, so much to the point where I had my clipboard and I was literally like taking notes on the sermon. It was really, 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 really good. So I also had clinical today for Gero. Today is Wednesday. So Today was a little bit different. I had a different type of resident. She was awesome as well. She was on the short-term side though. Well, not side, because they don't have short-term and long-term sides, but she's only going to be in the skilled nursing facility for short term. So she did fall twice at home, and she went to go see her doctor, and her doctor referred her to the skilled nursing facility. And so she probably will end up being discharged by the end of this week, if not beginning next week. But she was really, really nice. She was from Hawaii, so that was really awesome. And she was from Oahu. I don't know if I'm saying that right. Oahu, Hawaii. So I was able to talk to the resident about my friend who was actually born and raised in Hawaii. So having that commonality with the resident allowed her, I think, to get more comfortable and just engage in conversation with me more. So that's really it. That's what I have for you all. And that consisted of week 1 and week 2 of Peds and Gero nursing. Again, if you are loving my content and you love this video, please don't forget to subscribe, and please don't forget to like this video, and I will see you guys next time. Bye.